Welcome to Making the Gift of Life. We hope these short presentations will help you make your decision about becoming a live donor. We'd also like to thank the staff and patients of Guy's and St Thomas's Hospital and King's College Hospital for their help in making these programmes.
Hello, this DVD is designed to share the information that we have about living kidney donation with you. We hope that this will help you to make your decision about whether or not you wish to be a living donor. For the professionals involved, this situation is very different from how we usually advise patients, because we're not discussing something that will make you better. When we discuss living kidney donation, we're advising healthy people about a procedure which they do not need to have to improve their own health. Here, we can potentially only do you harm, so we want to ensure that your decision is well informed and entirely voluntary. Kidney transplantation from living donors is now an established and successful technique for the treatment of kidney disease. We think that it is the best form of treatment for the individual with severe kidney disease, and the risks to the donor are minimal.
If you decide that you wish to be considered as a donor, you will be contacted by a living donor coordinator who will perform an initial health check and establish whether there are any major issues which would exclude you from further assessment, including your compatibility with your recipient. You'll then be asked to attend the hospital for more tests and consultations to assess your health and suitability as a donor and to ensure that the risks of surgery for you are minimal. Your medical assessment is performed by a consultant nephrologist or kidney doctor. And if this is satisfactory, you will meet the transplant surgeon who will discuss the various options for surgery that are available and advise you about the risks of each procedure. You will have a number of investigations, including blood tests, heart tests and scans of your kidneys. If you are an older donor, it is likely that you will have more tests. It's not unusual to come across problems during the assessment process that could prevent you from being a donor. This may not mean that you're an unhealthy person, merely that you are not a suitable donor for a very specific reason. Equally, you may decide that you wish to withdraw from the process at any stage, and we will support you to do so, and your reasons will be kept confidential. When your assessment is complete, we can think about setting a date for surgery. We will always try to fit in as much as we can with your commitments and requirements. Since the 1st of September 2006, the Human Tissue Act 2004 for England, Wales and Northern Ireland, and the Human Tissue Scotland Act 2006 provide the legal framework that governs living donation in the UK. Once the donor and recipient have been fully assessed by the transplant team, an independent assessment will be arranged locally for both parties, and the donation must then be approved by the Human Tissue Authority, which is responsible for ensuring that donors are not put under any pressure to donate and that there is no payment or coercion involved, which is illegal in the UK. Under the Human Tissue Act, it's also possible for a living person to donate a kidney anonymously to someone whom they have never met. This is called non-directed altruistic donation. Also, a donor and recipient who are incompatible by either blood group or tissue type can be paired with another donor and recipient pair in the same situation through a national matching scheme. This is known as paired donation, and you will hear more about this later. More information about the Human Tissue Act and Human Tissue Authority is available on their website at www.hta.gov.uk.
It may be that your donor assessment is carried out at one hospital and then you're referred to another hospital, the transplant centre, for the surgery itself. In this case, your kidney specialist will refer you to the transplant surgeon in the usual way, and depending where you live, the surgeon will arrange to see you either in your assessment hospital or in the transplant centre.
Any operation has its risks. Living kidney donation is classed as major surgery, and the risk of death is approximately 3 in 10,000 operations, which is similar to any procedure for which you would need a general anaesthetic. Other complications include bleeding, infection, blood clots in the legs, and other more minor problems. These fortunately are rare and occur in less than 1% of patients, but you must be aware that they can happen. While there is no
actual physical benefit from giving a kidney for the donor, many donors gain considerable satisfaction from helping a friend or loved one, and these feelings may last for a very long time. There are many benefits for recipients who receive a kidney from a living donor. We know that kidneys from living donors last longer than those from people who have died, what we call cadaveric donors. These graphs show the different outcomes from cadaveric and living donation. For a cadaveric recipient, 77% of kidneys will be working at 5 years and 58% at 10 years. With a living donor kidney, 84% are working at 5 years and 66% at 10 years. If we look at patient survival, the figures show an even bigger difference. For patients receiving a cadaveric kidney, 83% will be alive at 5 years and 61% at 10 years. For living donor recipients, 94% will be alive at 5 years and 85% at 10 years. It has also been found that kidneys last longer in individuals who've had a transplant before they need dialysis. We call this preemptive transplantation. This is difficult to arrange unless the recipient has a living donor, because the allocation of kidneys from the transplant list is unpredictable, and many patients have to wait for a long time on the list before a kidney becomes available. This is especially true of people with less common tissue types, and often applies to individuals from ethnically diverse backgrounds. A kidney from a living donor may prevent a long wait and avoids the uncertainty that many patients experience whilst they wait for a kidney to come up on the list. The benefit of a living donor transplant is that it can be planned, and so patients feel that they have some control over their lives.
It's quite possible to live a completely normal, healthy life with only one kidney. In fact, many people are born this way and never know it. We do need to do tests to make sure that both kidneys work well and that you don't have an underlying problem such as diabetes or high blood pressure, which might damage your kidneys in the future. But if both kidneys are healthy, the evidence suggests that after kidney donation, you'll still live a normal length of time without increased risk of kidney disease. In some studies, even after 20 years, there seems to be very little difference in health between kidney donors and their brothers or sisters who didn't donate. Some reports do suggest a slight increase in blood pressure following donation, but others show that this is no different from the increase in blood pressure that occurs normally as we get older. In fact, a large study from Sweden showed that kidney donors tend to live longer than the general population, probably because they're selected on the basis of good health and are very carefully screened prior to donation. Many people ask what happens if the remaining kidney is damaged, say in an accident. Well, an accident so severe as to damage one kidney would most likely damage both kidneys under the same circumstances, and there's obviously no way of predicting or preventing something like this. But there are certain medical conditions, such as kidney stones, which would put you at particular risk if you had only one kidney. We screen donors for conditions like this, and if we found that you had such a condition, we could take special precautions to protect you for the future. In general, being a kidney donor doesn't put you at greater risk of illness or accident than the rest of the population. That doesn't mean that you'll never get any other illnesses, it just means that your risk is the same as anyone else. We're also asked if it's possible to have children after donating a kidney. There's no reason why you shouldn't lead a completely normal life after donating a kidney, and for women of childbearing age this includes having children. You would of course have to tell your doctor or midwife so that your kidney function could be monitored during pregnancy.
The kidney is slightly bigger than a fist, and there are two main ways of removing it from the body. The open procedure involves a cut under the ribs on the side of the kidney to be taken out. This is quite a long scar, but it is the method that has been used for many years, and the surgeon can directly see the kidney as he works. There is also now a technique using a laparoscope, which involves a number of smaller scars. This is often referred to as keyhole surgery, and may be offered to you if you are suitable. Here, the surgeon places a small camera into the abdomen or tummy, and pictures are relayed to a TV screen whilst he works to remove the kidney with specially designed instruments. The kidney is then removed without making a large scar. Your surgeon will discuss which technique is more suitable for you and your particular situation. You may experience less pain immediately after the operation with the keyhole surgery, and this may help you to recover more quickly. However, it is possible to control the pain from either procedure with good pain relief. The long-term results of the two procedures appear to be identical. There may be a slightly higher risk of a problem with the bowels in laparoscopic operations in the very long term, but this is rare and only occurs in less than 1% of cases. During the week before the planned date of surgery, you and your recipient will need to attend the hospital for final blood tests and a pre-admission visit to ensure that everything is still safe to proceed. You will both be admitted to the hospital the day before the operation. Following surgery, you will be able to leave hospital if all goes well within 3 to 7 days. You will be given painkillers to take home with you and advice about what to do at home and when to return for follow-up appointments. Initially, these will be at the transplant centre, but can be arranged locally for you thereafter if you prefer. There is no diet or fluid restriction after the operation. You will not be allowed to drive for up to 4 weeks depending on the type of surgery that you have, and you should do no lifting for at least 6 weeks. It is important that someone can go to the supermarket if you live on your own. The length of time you will need before you return to work or resume your normal lifestyle is largely dependent upon your own recovery, the type of job you do, or the activities that you enjoy. We advise up to 3 months following the open procedure before resuming strenuous exercise. Most donors feel this is about right when we speak to them after they have donated. Sometimes donors and recipients have blood groups which don't match. In other cases, the recipient may have antibodies against the donor kidney. They are known as highly sensitized. In both of these situations in the past, we were unable to carry out the transplant, but now it is often possible to treat the recipient before surgery. Essentially, we remove some antibodies from the recipient to allow the transplant to go ahead. This is not always successful, but can usually be done. If the transplant goes ahead, the results will be at least as good and probably better than using a deceased donor kidney. An alternative in these cases is to undergo what is known as paired donation. Once you and your recipient have been fully assessed, your names are entered into a national pool with other incompatible pairs. About every 3 months, a computerized matching run is performed to match as many pairs together as possible into compatible exchanges. Surgery is then set up simultaneously with 2 pairs so that a kidney from one donor is then transported to the other recipient and vice versa. The advantage of this scheme is that the recipient does not need to have the antibody removal treatment before the transplant can go ahead, and the success of the transplant should be equal to a straightforward living donor kidney transplant. However, not every pair will be matched with another pair, so it can be more difficult to predict if and when a transplant may happen, and for you to plan ahead. It should be possible to enter the scheme and to pursue the option of donating to your own recipient at the same time. Antibody removal may not be available in every transplant centre, so you should discuss this with your own transplant team. If you are offered an exchange, you may decide to take it. If not, you could still potentially donate to your own recipient.
It's important that you discuss the donation with your family, friends and work colleagues. You will need help and support from your family and friends around the time of the operation, and it is important to plan this together in advance and for you to agree how they might be involved if they want to be. Many employers will give time off for kidney donation. For individuals who lose out financially, it is possible to apply for reimbursement for legitimate expenses, including loss of earnings. The mechanism for doing this is variable across the country, but it is an important issue and we will do our best to help you in any way that we can. There are many members of our team who are available for advice and support. You only need to ask if there is someone you wish to see. For example, a counsellor or another donor who has previously donated may be helpful for you to talk to.
We hope that this video has given you some insight into being a kidney donor, and that it will help you to ask more questions when you see the coordinators and doctors in the clinic. Donating a kidney is a major decision and it takes courage, so it's important that you have all the information you need to make the right decision. The best decision is the one that is right for you.
I started working with a new job, and shortly after that I started feeling ill. I got blinding headaches. At first I put it down to stress of a new job. Then I started being sick, and eventually I lost my appetite after a couple of months.
We kept insisting that he went to see a doctor, but like most young people, he didn't want to know. And then he started getting very sick.
My boss agreed that I could go home, but on the condition I went to see a doctor. So I went to the doctors, and they took a blood test just on the precaution. They said it's probably just stress or sort of nothing to worry about. So they said to call back on the Friday.
We had a very urgent phone call that said he'd got to get himself straight up to Queen Mary's, where they'd got a bed waiting for him. So off we trundled to the hospital, and they diagnosed kidney failure.
They explained why I needed to go onto dialysis because my kidneys weren't working at all well, and they had failed. They said they weren't working enough to keep me going, so they said I need to go onto dialysis immediately.
Because of his condition, he had to very quickly go onto dialysis, and James has got a needle phobia and just hates anything medical. Even though he'd been through 2 heart ops, it still worried him a lot, and the thought of having tubes in his stomach was really quite horrendous for all of us.
To start off with, I was told almost immediately when I got to Queen Mary's that I was going to need, as I was so young, I would have to have transplantation to be able to sort of actually survive for any length of time. So I knew it was, the end game was going to be transplantation, and I didn't really know much about transplantation at all at that stage.
Either a living donor, which I hadn't actually heard of. I've heard of people carrying cards, etc. But I didn't realise that you could actually give a kidney from a live person. And I decided straight away that if I could help him, then that's what I wanted to do.
The actual doctor then came to me and said, "Have you ever heard of living donor transplantation?" And I'd said no. So he explained how it works, and then he said, "Do you think anyone in your family would be willing to do that?" So I obviously then said that you need to speak to my parents. And my mum and dad actually went off and spoke to the transplant nurse, the living donor transplant nurse, and she explained it all to my parents. And then my mum came back, and we obviously had a long discussion, and she said, "I want to do this, I want to donate a kidney to you."
I think we were all willing to listen and see if we were suitable. The hospital really wanted one person to put themselves forward, and as my husband's a little overweight, my daughter events with her horses, so that was quite dangerous for her to think about donating a kidney in case she came off a horse and damaged her other kidney. So I was the obvious one, really.
I was obviously concerned. I obviously wanted it to go ahead because I felt that would be the best choice for me, but I didn't really want to pressure her into it. She was more or less saying to me, "I definitely want to do this for you." She said, "I'm your mum. I'm your mum, so like, I want to do this for you and my son." I was more concerned for my dad, if I'm honest, because he can't cope with medical situations. I knew that obviously my mum and I would be both going through a serious operation at the same time. So my mum more or less convinced me that she didn't really care about the operation. She'd rather risk her life for me than just watch me sort of die effectively.
I think we were all quite worried about the process, but we had lots of pamphlets, people talking to us. We went to a lot of talks about the whole process so that we'd know exactly what to expect. My son and I both take a different attitude. I tend to think, I'll do it, and if I'm in pain, well, I'll worry about that then. Whereas my son wants to know absolutely every detail that's going to happen to him, and how it's all going to happen and when it's going to happen. I'd rather they just got on with it and I sorted it out afterwards.
I spoke to the medical staff quite a bit. They actually put me in touch with a counsellor because from going on to dialysis to actually having the transplant was a 12-month period. So we had quite a long time to discuss it. So I had a few months with a counsellor, and we sort of went through, because obviously the whole shock of the kidneys packing up and then having to deal with the transplantation.
Obviously, any operation there's a slight risk, but I wasn't going to be the one dealing with that. I did feel very sorry for my husband because he had both myself and my son going into quite a major operation at the same time, and my daughter, of course, as well. But from my point of view, no, I wasn't really worried.
The information I found most useful was the actual transplant talks by the patient, and then obviously you can actually ask the patient, and you actually tend to believe the patient a lot more, because although however good the doctor is and they say it's not going to hurt, you never believe a doctor because he's never actually been through the process. So actually seeing a patient, seeing a scar, seeing the lump of the kidney, being able to talk to them and knowing they've been through it and they've actually survived, and then being able to ask all the kind of questions in private with them which you don't really want to ask the doctors, that all very much helps.
It was in the early days of keyhole, and I did express an interest in doing keyhole surgery, but I had an extra vein, I think it was, and they advised me that it would be better to do the traditional way. And at my age, I wasn't worried about a scar at all, so I decided that, on the advice of the doctors, that that's what I'd do. Everything was explained in great detail, why it was being done, how it was going to be used, the information given, and you do get a very good, clear bill of health yourself, because they've ruled out any major diseases. So by the time you've been through it all, that you know you're pretty healthy. I was in the hospital for 6 days, and then I was allowed home. James stayed in the extra day. He was home on the 7th day. I came back to Mum's house. I was here. I came home on the Thursday, and we've got a children's riding club, and it was their first competition on the Sunday, and I really wanted to go, and one of our ladies is a doctor, so she came to pick me up here, took me there for the day. I had a beautiful day, watched the team ride and everything, and then she brought me back here in the evening. And admittedly, I only sat in a chair and was fed and that sort of thing, but I felt absolutely fine. I was here for about 2 weeks, and then just slowly started getting back into going to work. I could feel a sort of dragging feel when I'd done enough, so then I used to just sit down, and when I felt better I'd get up and do a bit more.
I think we're very much closer now. Definitely is a stronger bond there, and I'm obviously very grateful for everything she's done. She put her life on the line for me. I'm never going to forget that.
I would say definitely go ahead, as long as they're happy to do so. Obviously it's an individual choice, but I would point out that their relative's going to be so much healthier, and you just feel better seeing your relative looking so much better. And you know, when I see him running up and down stairs and that sort of thing, which at one stage he just didn't have the energy to do.
The transplant has given me a second chance at life. I feel I'm very confident, much more confident now than I was before, because I feel I can deal with any situation, because that renal condition is one of the most difficult and ongoing medical conditions. So I've convinced myself if I can deal with that, I can deal with anything in life.
You're not going into this to get better, you're going into it to get somebody else better. And I was also told that there was a slight chance that it wouldn't work and how I'd feel then. But I was going to lose a kidney whatever, so if it didn't work, it still wouldn't matter to me. Obviously it would make a great deal of difference to James, and we would have had to have accepted that had it happened. But it didn't.
I think it's the best thing you could do. You're saving someone's life, and the link and the improvement in the relationship between donor and recipient is amazing.
We went to see the doctor, and they keep on having his blood test and everything, and the kidney failure was going very rapidly, and he was taken in the hospital, and we were told that his kidneys has gone, and that was very hard to hear.
Well, as soon as you go onto dialysis, they do inform you of all the options, including live donor and including like CAPD and APD, and at that time they said, oh, you probably can get a donor within 18 months to 2 years. I'm quite strong enough and healthy enough, and I'm strong-willed as a person anyway, so I thought I can wait that. I don't really want to put anyone in my family through that. And so I thought, yeah, I'll just stick with the dialysis. I thought 2 years, I can handle that.
Whenever I was in the beginning, when I ever even asked him, shall I have a blood test to see even if it's match or not? He says, no, mom, no, you don't give me a kidney. He makes any other excuses, you are too old and like that. And I kept on listening to him.
I never thought of it as negative that I wouldn't get a donor. You know, always keep a positive outlook, try and carry on as best to normal and think about it that way. But obviously as time got on, I was trying to carry on going to work and it was getting harder, body was getting weak and I was more tired generally, fatigued.
So a lot of the people get within 2 years time. And so the judge thought he will stay on the dialysis until he get the kidney. But it took about 3 years and he was getting weak and he was very miserable, and so we thought, then I told him I would like to give the kidney.
Well, it was more a direct conversation with Mum, and I was saying I don't want to put you through such a big operation, because obviously at that time I wasn't fully informed of all the options apart from the fact you can have a live donor transplant. But you think to yourself, oh, that's a big operation for me as well, but do I really want to put my mum through that as well? And I thought, no, I don't want to do that at the time.
So I made up my mind, and the next time I went with him for his appointment at the doctor's, and I told them I would like to give.
I don't think it was more of me being convinced, it was more my mum saying she was absolutely determined. She wanted to come along just to have initially the blood test to see if she's a match. And basically, because I was so weak and I was getting very tired, I thought, okay, well, let's just have the blood test. I mean, we won't consider anything after that, but yeah, if you want to have the blood test, we'll do that.
Then I had my blood test, first blood test, and that was good. Then I had my scans and kidney scans and the rest of the test.
You get more information from the transplant coordinator and all the renal nurses, and obviously my uncles are doctors in the States, and you talk to them, email them, and start doing a bit more research on my own in the internet, and you can find more facts and figures which probably I didn't do at the early stages. And you know, it may have changed my mind at that point if I'd done that at the early stages, but at that point I didn't want to put my mum through it, so I'd done all that, and the information is all there. It's just a matter of obtaining it and getting a good overall perspective of the whole process. I still felt uncomfortable putting my mum through quite 6 months of various tests, which are some of them quite strenuous, some of them quite simple, but she did sail through most of them, and she was always strong, and you could tell she was determined to go through it. And so once you could see that, I thought, well, let's see how far we can go, because there's no guarantee that she can donate her kidney, because of these tests are very rigorous, and it's got to be absolute 100%.
I wasn't scared at all like this operation. Somehow I believe in God, and I had all this strength in myself, and I had never second thought of it.
It's still nerve-wracking to think there's a huge operation ahead, not only for myself and my mum, but as you get closer and you get more confident with the doctors and how they're answering all your questions. So as it got closer, and my mum was always strong throughout, so it's not a case of me having to reassure her. It was probably she was more reassuring me that, don't worry, I'll be fine. You know, I want to go ahead and do the operation. So she was probably as supportive to me as, you know, I thought I should have been to her, and the family were to both of us.
I went on Thursday, the operation was on Friday. In the afternoon I went there, the doctors came around and they checked me and they asked me questions, and had I any other operations before.
I can remember everything quite clearly from the point of going down to theatre. Obviously my mum went in first, but she had to be prepared beforehand, and then obviously I followed after. I was awake right until the point of going down into the theatre, pre-med room, and I was actually chatting quite freely with all the medical staff down there. I
asked for Chase, where's Chase, and he wasn't in the ward at that time, and I was dozing and I was looking for him, and he came a bit later, but the doctors told me the kidney was functioning straight away, and I was so happy.
And then the next thing I remember is waking up in recovery, a bit disorientated, but then once I got back to the ward, my first question I asked was, how's my mum and how's she doing and where is she, and looked over and she was there, you know, doing quite well, awake by that time. Obviously I'd come up a lot later than my mum.
Within a week, I was out of the hospital Thursday. The Friday the operation was done, and the Thursday I was out. After 8 weeks, I was nearly back to normal. Yeah.
I'm glad she talked me into it because the change in my life has been dramatic. Obviously, it took a lot of strength from her part to convince me and draw me into me, like, you know, let me do this for you. So, yeah, it's been great.
I'll say go for it. Don't worry at all. All the doctors, nurses, all the people will help you, and try to find all the information you can and understand everything. There's nothing to worry about it, and you'll do a great job and you'll be very pleased afterward. I'm so pleased.
Really heard about living donor transplantation when the doctors advised me that my kidneys were deteriorating, and obviously I would be needing the possibility of a transplant. And then obviously the words were mentioned then to me. Prior to that, obviously I was only aware from people carrying donor cards, but not really much further information than that, really.
But when we were actually told that Sue needed the kidney, basically it was just at one of the consultations, and the doctor said that Sue would have to go on dialysis with a view to going into a donor. My first reaction was, well, put my name down, let's move forward.
Obviously the concerns I had is sort of his success rate. Would it be successful for me to receive it? And obviously how he would be affected by it, sort of physically and mentally.
I had no reservations at all of actually stepping forward to offer my kidney for Sue. Main reason being was Sue needed it. You know, the outcome far outweighed any concerns that if I'd had in my own mind. But no, it was as soon as the doctor had said Sue needed a transplant, I said yes, and my main thought process really was to erase all the pain and to get her back to the life that she should have without any fear to myself. There was no concerns because the benefit far outweighed anything that may have happened to me. The support given to us by the transplant team and Lisa and everyone else was fantastic. Everything, you know, there was a DVD, there was booklets, there was also talking where they, you know, she said if there's any questions or anything you'd like to ask, then just please ask. We then spoke to other people who had or were going for transplants and had transplants, and we found they had a number of classes that they'd actually set up where you could actually, people that were being worked up towards having a transplant, both the donors and the recipients, could go and listen to people that have had them done already. And we found that the most rewarding really, because people were talking from first hand, and you know, it just answered all the questions, and you could actually talk to them afterwards, even to the extent of saying, well, you know, can I have a look at your scars? It was something that was really, there was just an openness and a support that was great. The screening process, I think, brings questions that you don't actually anticipate or appreciate. And the first question really is when someone says, well, have you got 2 kidneys? Because you don't know. You don't get up in the morning and go, oh yes, I've got 2 kidneys this morning. So I think that they put little barriers in that are quickly broken down, but you don't even think about it. My first reaction was, yes, put me down. Then it's, well, have you got 2? And you think, well, I never really thought about that. So I think that there was nothing particular that daunted me, but it was just the different questions that you weren't expecting to come up. But they deal with them so well, it's not a problem. One of the consultants actually went through all the aspects of the operation, both the traditional way which would have been a large cut, and also the implications of time off after work and the recovery period, and also the benefits of keyhole surgery. And then it was your decision, but obviously you listen to what the advice is given, and being, knowing that I would have to have 2 or 3 months off work, I wanted to get back as soon as possible. And with technology moving on the way it is, keyhole surgery seemed to be the way forward, and as it was, it went very, very successful. The recovery process is very swift, but also you have to bear in mind what you've just been through, and I think it's very easy to think I can start doing things, but you get a lot of advice on what you can and cannot do. After the operation, you're up and walking around, or shuffling around I should say, the next morning, and then 2 or 3 days afterwards you're on your way home. You have to take it easy and start walking around the block, making sure that you remember that although you haven't had the side of you completely sort of opened up, it is the muscles and everything that's centrally that has been worked on, and I think that's the most important thing to remember, that you don't overdo it. But I didn't find any problems at all. Within a week I was going up to see Sue in hospital, doing normal things, walking around the corner, and just generally sort of thinking, was it as easy as that? I went straight back into work without any real fears. I thought I would have to sort of go and start slowly, but by the nature of my job, it was straight in at the deep end. And although you have to make sure that you don't overdo it, it had no real adverse effects, especially physically. My job can be physical, and I had no adverse effects apart from the fact that you're still under orders really not to do any heavy lifting, and you must remember that. That's the main thing, that it's a lot of work has been done, and you mustn't undermine it by thinking, oh, I can do that.
The advice I would give to other renal patients is I always put myself in their shoes, where I was before, and the things I found beneficial to me were to talk to people, obviously patients waiting in the waiting room. You get lots of information from people that have already had transplants. Just talk and ask questions, speak to the doctors, read leaflets, attend the talks that they have, and ask lots and lots of questions.
Anyone that's given the opportunity to consider living organ transplantation should really look at the benefits that will give to the person that's receiving it. Looking now with the change of legislation that's come in that wasn't there when we had ours, even if you're in a position that you can donate to someone that is not particularly your family or your partner, bear in mind that there's someone outside there that would also be able to donate to your people. So, without living organ transplant donation, things are going to dry up, the lists will get longer. I'm sitting here 13 months after thinking it's the best thing that I've ever done, and at the end of the day it's brought a lot of pleasure both to me but also to Sue, my wife, and the thing is I would do it all over again if I had the opportunity.
The transplant itself has changed my life incredibly. I was on dialysis, albeit a short period of time, but it's given me my life back. It's taken away the severe routine that you have to undergo with dialysis. I can do lots more activities, go out when I want to. I've got freedom back. It's given me a real zing and a different outlook to life. I just want to live it to the full, obviously nurture my kidney with tender loving care because of obviously where it's come from. It's made me a very confident person, changed my whole attitude.
I think the relationship that I have with Sue has been one of the strongest. She's my best mate anyway, and always has been, and I think it's just improved on that. I think the thing now is that we always had an understanding and we always used to almost think the same things. Now it's almost like we're one, and it's spooky. It is spooky, and there's certain things that Sue does now that would never ever have done before. The World Cup was on, as who was never a football fan, and it was like she was telling me when the football was on, and it was like, where did that come from?
Obviously, receiving the kidney from Tim is obviously very special and very close to my heart. It has brought us far closer. We've always been a close couple anyway, but in what way, I'm not too sure really. I think I tend to appreciate him possibly more. Oh, I'm getting all...